So my second case for the day, very interesting case, nice lady from Indiana. So she has the implant silicone 415 according to the card, gel, done 2020. And many complaints of breast implant unless done below the muscle. And so as you will see, complete end block 102925, initials KH. And as you'll see, relatively very thin capsule. You can see it's transparent, thin all the way around below the muscle, right on top of the rib. Relatively very large implant, and the muscle indeed was very much repaired. I cut out the excess skin. This is where it was working as what is a tissue expander. As you can see, she had a lift. So very prominent scarring that was also removed in order to allow for what is that Kondekai pseudo lift, if you will. And so this is where, as I go in, you will see, as I go in, ultra thin capsule, leaving behind all good, precious, good volume. And as I go in, you will see, no matter how thin, please continue. So I'm going to go ahead and place the ruler right underneath. You can see how transparent thin this capsule is. No matter how thin, it has to go. That is in my practice, because we don't want to take any chances. And I'm going to put the ruler here. You can actually see end block complete, and very happy how everything went. Minimal blood loss below the muscle. The muscle was indeed very much repaired with 2 Ovicro. If I put my glove here, you can see again how thin this is. So implant, just 5 years old, very much intact. Now remember, this is what the nice doctor was saying, the one I had a discussion with from the Netherlands. If I go like this, look at this leaching of that silicone from the intact silicone. And if you ask me, that is that gel bleed phenomenon. Mentor 415, just like the card very well said, and what I would say a brand new condition. And very nice and normal looking capsular tissue that's so thin. You can see how paper saran wrap thin this is. Some areas thick, but the entirety of the implant capsule has been removed. I'm going to send these other pieces that were removed. So a lot of symptoms of breast implant illness, hence her desire for removal of the implants, essential surgery, non-cosmetic in nature, medical necessity surgery, and again, the very thick scarring, contouring. This is where the implant was working as a tissue expander, the left side end block, the gold standard, and again, complete entire implant capsule removed, so all the precious volume left behind. And I'm going to cut this open. And as you see, super ultra thin. Remember, this surgery is about precision. It's not about speed. It's about repairing the muscle when it can be repaired. Her surgeon did an outstanding job, I have to say, putting those implants in. And the way the muscle was essentially left as is. And so a lot has to do with that. Very slimy and slippery. As you can see, look how thin this is. Entire implant capsule has been removed, and if I go in, you can see that stickiness. Alright, and so this is your 415 Mentor implant, just like the card said, encapsular tissue that's so transparent thin. You can see my glove, all of it has been completely, sincerely removed. No capsular tissue remains behind. I'm going to send this in. This was tissue on the side just to be complete. So you can see, look how it looks like a red blood cell with a small indentation. It's normal. And this is where both in brand new condition, 5-year-old set of implants. And so there you have it. So end block, the gold standard. You saw that leaching, even though these are intact. Super ultra thin capsule. No matter how thin, in my practice, I remove it completely, no exceptions. It was a very tedious, meticulous dissection underneath the muscle with the muscle repair that was done, reinforced times 3. She's going to have good aesthetic function, and she's going to have good physiologic function as well. aesthetic results and physiologic function as a result of the repair. So the muscle repair absolutely must be and done sincerely, because it allows not only for functional recovery but also aesthetic recovery. And she's going to be very happy and delighted to see and hear that. What is interesting is we were just talking about this in pre-op right before her surgery, and this is where the muscle must be repaired by the surgeon, and a lot is dependent on how the previous surgeon did the surgery. So there you have it. So implants will be returned to the patient, capsules to be sent to pathology, cultures for Arabic and fungal, no need for drains, no need for the unnecessary lift. Even though she has what are very large implants for her chest with twilight deep sedation, high definition pictures and videos of not only this, very importantly, but also very importantly, the chest wall showing complete removal of the entire implant capsule. And no matter what, from one step, one patient to the next, the muscle repair must be done, because that allows for not only aesthetic recovery, but also functional physiologic recovery. And she is a CrossFit athlete, I would say professional grade, and she will be doing that in the near future once she recovers. So there you have it. This is Dr. Khan, Executive Plastic Surgery.